Hello, I'm Dr. Charlotte Middleton and welcome to what is going to be the last video in this topic of the month, which is pregnancy and birth. So this is going to address migraines in pregnancy, particularly in reference to a follower's question. She's 7 weeks pregnant, is taking or has taken Migraine and Relpax, which are the triptan family of drugs, during the pregnancy, and was wondering, are these safe and what other medications she might try. Now, before I actually discuss the medication side of things, I'd like to just talk about migraines in general. And what we know about migraines is that they're a vascular type of headache where you get an acute dilatation of vessels in the brain, causing what initially can often just start as a mild headache, but quickly becomes this constant throbbing, pulsating pain in the head. It can either be in the temples or the front of the head or even at the base of the head, often only just the one side, often associated with things like nausea, vomiting and photophobia, which is a sort of a sensitivity to light, which is often why you'll hear migraine sufferers basically just having to lie in the dark with a cold compress on their head until the migraine actually passes. We also know that some people get auras, as is in the case of our follower who describes having migraines with aura. And auras can be a very individual thing, but mostly can be either jagged or wavy lines, dots, flashing lights, tunnel vision, or even blind spots. But as I said, can be very much an individual thing as well. So, and what we do know is that people who experience migraines with aura prior to a pregnancy often do continue to have those migraines throughout the pregnancy. Unfortunately, when it comes to pregnancy, it's a little bit of a lottery. For some people with migraines get better. For others, they get worse. Some stay the same. But as I said, often people with auras pre-pregnancy will continue to have migraines with aura throughout the pregnancy. When it comes to medications, unfortunately, we only have a few that we recommend during the pregnancy. And this is generally because, as you can imagine, it's quite difficult to conduct randomized controlled trials on pregnant or breastfeeding women for ethical reasons. And so most of the evidence that we have is circumstantial. What we know is that Migraine and Relpax, which again is what my follower has been taking, they're the triptan family of drugs, and unfortunately they're generally not recommended through the pregnancy. And this is basically because we just don't have enough evidence to say that they are necessarily safe during the pregnancy. However, I do know of some instances, and quite a number of instances, where they have been taken during the pregnancy and at any trimester, and there has been a reassuring lack of side effects, but not enough that we can generally say that they are safe enough to take throughout the pregnancy. What we do know is that paracetamol is considered to be a very safe drug, and you can take that throughout the pregnancy for migraines and headaches. Aspirin and Nurofen are generally not recommended. Most anti-sickness medications are okay, and that's something that you would have to discuss with your doctor. Something else that you can discuss with particularly a headache neurologist is something called an occipital nerve injection, where an anesthetic and steroid injection are put into the base of the skull to try and relax the muscle that surrounds one of the nerves that we know can cause most of the problems. Low-dose propranolol has also been used throughout the pregnancy, but generally is not, prolonged use of that is generally not recommended. Complementary therapies that we know can confer some benefit are things like upping your intake of vitamin B6, 12 and vitamin B2, folic acid, vitamin D, magnesium. They all can sometimes help with headaches and migraines. One of the most important things, though, that you can do is to recognize and then avoid any known triggers. And again, can be a very individual thing as to what those triggers are. Sometimes it's great to keep a bit of a trigger and symptom diary to find out what exactly are your triggers and to then avoid them. Other things that people talk about helping are things like cold towels, ice packs, even alternating heat packs and cold packs, cold showers, a nap, some exercises, biofeedback and relaxation can all help as well. Basically, the bottom line is that you need to talk to your doctor about what is considered safe, but often in some cases too, the discussion can be around a certain drug. Sometimes the benefits of the drug might outweigh the risks, and so this is where you need to have an open discussion about what medications will work best for you. So to our follower who's currently pregnant, I do wish you all the best. Please do see your doctor to talk about this further.